Clinical supervision is every time you talk about your staff as a clinician. It's not handover when you just talk about tasks, but it's any time when you have a conversation with a colleague or with a group of staff about your patients.
So clinical supervision is one of the 3 tools that we use as an organisation to give assurance that the staff member is giving the optimum care to our patient group. The other 2 tools that we use are appraisal and mandatory training.
It is about enabling people, and it is about, promoting independence, and obviously that's got benefits for us as well, because then we can prioritise, the patients that need us, rather than us going to see patients where actually we feel that they can be more independent if they're given the right skills to do so.
Our role is about keeping people safe, keeping registrants safe, keeping nursing safe. We are very, very keen to make sure that our colleagues working in the field are practicing and demonstrating that they are practicing as safely as they possibly can be, because that keeps all of us safe and it keeps patients safe.
It's that recognition that actually a conversation with the GP, whether it be on a telephone or whether it be in a gold standard framework meeting, actually that still is clinical supervision. We're talking about patients for their benefit.
Clinical supervision is embedded within occupational therapy from a student, so I've always understood the benefits and benefited both from being a supervisor and a supervisee. There are incidences when they've been on visits in the morning, come in and said, "Can I just run this by you? This happened this morning." That's clinical supervision, when the team talk about an occasion where that's happened. Not understanding that is saying we don't have time for clinical supervision. But actually, you've probably been doing it on a number of occasions through the day and just not realised that that's what you've been doing. I feel that my staff feel supported by me through me delivering supervision to them. That obviously helps with the cohesion of the team, understanding the training needs, understanding that they are delivering high quality care to patients that we have on our waiting list and on our caseloads.
For members of staff, it's so important that you have this time, and you are having it. It's a time for you to reflect, to think about your practice, to talk to your critical friends. Are you doing the right thing for that patient, to give them the best quality patient care?
The supervision sessions I run are for healthcare assistants or HCAs. We hold them every 6 weeks. We sign a register. We then go over anything that's outstanding from the last supervision session. If there isn't, we just move on, and I just open it up and say, would anybody like to start the discussion off? Who's got something that they want to bring? Anything. About 5 minutes before the end, I pass out the tool for them to all for the auditing to say if they found it useful, how long it's been, etc. What issues we discussed, nursing, personal.
When we first started doing clinical supervision, we didn't have many staff in the team. The caseload was very high. The stress level was incredibly high. So just given the opportunity to sit there and talk was good, so that on its own was beneficial. Clinical supervision, it's morale boosting, so therefore it's going to reflect in your practice. It's the only opportunity that we do have as HCAs to sit there and discuss things.
Yeah, supervision we do day in, day out, whether that's clinical or restorative. We're discussing clients and cases all the time, and that is clinical supervision. In the job that we do, it's highly stressful, there's a high level of burnout, and it's about enabling staff to have that time out in a protected environment. If staff don't access supervision, then I think the risk of burnout and the risk to clients could be increased.
For me, restorative supervision is being given some protected time to take a step back from everything that's going on at work and look at how it's impacting on me. It felt a bit strange to begin with, because it's not something you're used to at work. You're usually more focused on the clients, things that are very much work related, and you come out feeling in a better place for doing your job at the end of it. I found it really useful to have someone that wasn't anyone that knew me, that I could just sort of talk through these things.
So I think really it's about enabling me to reduce my stress levels, readjust your work-life balance as well. If you're burning out, there's only so much you can take, isn't there? You can't come in and sort of prepare for the next day's challenge if you're totally overloaded.
We've got examples every day of how clinical supervision helps our patients. I've only just been speaking to a gentleman on the telephone who was explaining to me how the nursing staff have helped train his carers, so now they can give him his insulin. So that's where supervision comes in, and it's about enabling patients to do as much as they possibly can.
At first, after leaving hospital with another problem, that's when they discovered that I was diabetic. In 2007, I had a spinal cord injury after diving into a swimming pool out in China. So after a period of time, they start to come in to train my PAs, my carers, who live with me, and it just made life so much easier. I could make plans and I could live my life without getting that organised. We haven't got any life, and that's due to the help with the DNs, the district nurses, and certain other health professionals. You have to become a big family, and you do. It wouldn't work if you didn't communicate between yourselves.
Clinical supervision could take various forms, from discussing the outcome of a clinical intervention to having a conversation about care planning for the future and taking advice, if required, on what the next steps for the patient need to be.
We do encourage staff to capture it on workflow, on System 1. If it's group supervision, then what we're going to try to do is nominate one person to put it on for the rest of that group, so that we are capturing, who is having supervision.
And particularly for nurses, now with revalidation, this is your way of proving that you are keeping yourselves up to date, and you can use this for your revalidation process.
If you have the new staff activity icon, you can click on this. If this isn't visible on your screen, you go to the top of the screen and choose workflow. This will give you a drop-down list, and you scroll down to new staff activity. And the first thing you need to do is put the date that you've received your supervision. The next is the contact type. If you click on the little arrow, it will bring a drop-down list, and you choose clinical/restorative supervision received. You then choose the location where the supervision took place, using the same method, and then the duration of the supervision. Do not put anything in the target groups or attendance, and then scroll down to the bottom of the box and click OK. This can be completed at any time within a calendar month. If you have forgotten to record your clinical supervision, please do go in and backdate this at any time.
Got clinical supervision champions. We're trying to do a display and a notice board so that it's there in people's sight, so they can't forget about it. And I think the message to get across is to talk about it at team briefs, talk about it at your team meetings, just remind people to formally log it under workflow and record it, but just embrace it and get the message out there.
But more than that, clinical supervision actually supports the staff wellbeing, and we all know from the research that if we look after the staff wellbeing, then patient experience will be positive.
We need to give assurance to our teams, to our division, and ultimately to the Trust Board that we are actually having clinical supervision, that our staff are at the top of their game, and most importantly, they're delivering high quality patient care.